welcome everybody. We are so excited to be on this webinar today to share our latest consumer insights around children's mental health. I wanted to introduce myself. I'm Alex Lewin-Zordling. In case we haven't met, I oversee the Root Cause Coalition's research and specifically our monthly Pulse Insights research that we've been doing for the past year. If you haven't seen it, we released at the end of the year our TAP report, Trends, Attitudes, and Perspectives, that summarized last year's consumer insights. So I highly recommend that you check that out if you haven't already. As you're popping in, please use the chat to introduce yourself with just your name and your organization, maybe something that interests you and why you joined today. I also wanted to give a big and welcome introduction to Elainey Almandrez from the Children's Hospital Association. CHA is a member of Root Cause. They were a wonderful collaborator on this research. We were thrilled to work with them. They had the idea to study children's mental health from a public insights perspective, and we're just so happy to be able to have done it with them. It's obviously such a timely topic. It's in the news every single day. It's becoming increasingly clear that this is a crisis that everybody needs to deal with increasingly from both a policy and programmatic perspective. So you'll see some of the insights that we will share today. And then I will turn it over to Elainey, who's going to talk a little bit about CHA's Sound the Alarm for Kids initiative, which is very related to our research. So if you haven't done so, I think everybody should have access to the chat. I see it empty, so please do introduce yourself and your organization. A little bit about Root Cause's research, if you're unfamiliar with it. Today, just about an hour or two ago, we released our mental health survey, which I will go through the results today. I think they're really, really interesting from multiple perspectives, policy and otherwise. But for the past year or so, we've been doing these monthly pulse surveys. I alluded to the TAP report, but we've covered so many different issues around what consumers think, what they perceive, what their attitudes and behaviors are as it relates to climate, as it relates to COVID, as it relates to mental health, as it relates to behaviors past, present, and future. We've got a study coming out next month that will look at kind of COVID behaviors over the past 2 years and what people think and predict about their future behaviors in the face of Omicron, and just kind of hopefully, fingers crossed, coming out of the pandemic into more of an endemic situation. So thank you everybody for introducing yourself. With that, I'm going to share my screen and I will walk through the results of the mental health research. And then, like I said, I'll turn it over and introduce Elainey, who's going to talk a little bit about CHA's initiatives. Okay, so let's go ahead and share. And here we go. And please, if you have questions, please feel free to add them into the chat as we go, but we will have ample time at the end as well for discussion. Okay. And Madison, who I know can see the chat, if there's something that comes up, please do interrupt me. This is not meant to be a very formal presentation. This is meant to be a discussion, and hopefully we'll have a chance to hear from all of you. Okay. So like I said, this survey, the results of this survey were released just about an hour or two ago. Maybe some of you saw the press release come through. If you haven't yet, it's available on our website and will be available on all our social channels as well. And thank you again to CHA for being a wonderful collaborator on this project. So I'm going to just dive into the results. If you are familiar with Root Cause's research, you're probably familiar with the way that these charts look. But in general, when we have these scales, they'll go from dark green to bluish. In this case, we've got about 11 or 12 questions that we asked in this survey. The population is nationally representative. You'll see the sample size in the lower left-hand corner, and then you'll see demographic specifics after the general findings. If any of you have questions about some of the demographics that I'll share today, please do follow up. We're happy to share any of the data as it's relevant to your work. You'll also see at the bottom of each slide just the question that we asked, so it gives you a little bit better orientation to what the tables represent. So here, just question one, thinking about the past year and a half during COVID, please select which is most appropriate. And the scale goes from I worried a lot to I didn't worry about it or I don't know. And so you'll see here physical health issues and mental health issues, and just drawing your attention to the last two rows on mental health. You'll see roughly 2/3 of individuals say they were worried at least a little bit about their own mental health or their family's mental health. And then when you break it down by demographic, I think in a lot of these cases, the demographics are really, really where the nuanced, important information comes up and has really implications for our communications, for policy and advocacy, and just general education. So you'll see here where you see red in general on these demographic slides and a down arrow, it means that there's a statistical significance from the other sub-demographics in that category. So for example, if you look at the third column where it says my mental health, and you see male and you see that 25% down arrow, that means it's statistically significantly less than the females, which have that up arrow, which was 36%. So the takeaway there is that females are statistically more concerned about their own mental health during this period of time than males were. Also Blacks, also those who are under 45, as well as parents. You also see similar trends when you look at family mental health. Okay. So what did people experience of those who are worried about their own mental health? And you see very similar findings in the next series of slides when we ask about the concerns about the family mental health. So here you see over a third say they had changes to their behavior, they had changes to their relationships, and roughly a third say they had changes to their diet and eating patterns. I think these are like ripe for further exploration in a follow-up survey, right? Like what changed about your behavior? What about your relationships? And then what are some of the interventions, obviously from an action perspective, that are needed? And then again here, you see the demographics. And I think the one call out here, if you don't see the red or the blue, there isn't statistical significance across the demographics. But here, if you look in that fourth column, I had physical symptoms. You see that parents are more likely than non-parents to have had physical symptoms for those who are worried about their own mental health. Okay. So this shifts gears a little bit into family mental health. So for family mental health, it's very similar in terms of what the behavior changes or general changes were that they saw when they had these concerns. And again, you see changes to relationship with family and friends. You see changes to behavior, physical symptoms, a little bit less percentages on the changes to diet and eating patterns. That's really like of greater concern for oneself than it is for their family, but it's still up there with about a quarter of individuals. And then of those that were worried and reporting behavioral changes, you can see those who are older had statistically higher changes to their behavior. Those who are younger had statistically higher changes to their diet and eating patterns, as well as those who were higher income earners and parents. And we see this general trend in the surveys that we've done, and it's not terribly surprising, but you see higher income earners, college educated, parents, and sometimes those who are under 45 kind of track similarly in responses. All right, so this survey was fielded in December, which is, I think it was pre-Omicron or right at the start. So take this one with a grain of salt. But we asked about feelings of being hopeful over the next year. And you see about a half say they're more hopeful, and about 17% say they're less hopeful. And then about a quarter say they're neither more nor less helpful. We have a survey that we'll be fielding this spring that also looks at sort of violence, mental health, and feelings of hopefulness or kind of despair. And so I'll be curious to see how those findings compare to these. All right. And then if we look at the hopeful category, I think it's really interesting. So you see Blacks, those who are under 45, those who are higher income, those who are college educated, and those who are parents are more hopeful. Again, I think this is one that's worth drilling down in the future in terms of what does this mean and why, and how has the past 6 months or so kind of fed into this feeling of being hopeful. And then those who are less hopeful, you see the non-parents here kind of stick out. All right. So this talks a little bit about familiarity with mental health services, and then we'll talk a little bit about accessibility of mental health services. So here, familiarity, you see that dark green again is the very familiar. So about a third of individuals who took this survey said that they were very familiar with the services that were offered, and then another 40% or so say that they were somewhat familiar. And then you have this 16% saying that they're unfamiliar. And it looks small in comparison to the whole pie, but I think 16% is still significant if you say, nearly like 1 in 5 participants are unfamiliar with services. And then you can see here, again, the demo breakdown where you see kind of this trend that we've been seeing in the survey: Blacks, under 45, higher income earners, college educated, and parents report greater levels of familiarity than other demographics. And then access. I think this is a pretty hopeful slide. Over half of those individuals surveyed say that it's relatively easy to access these kinds of services. And then another quarter saying I can, but there's some difficulty. And only 1 in 10 saying that they don't have access. And then here's the demographic breakdown for that. And you can see this is interesting from an equity lens. So if you look at the first column, yes, it is relatively easy to access these services. And you look at the less than 40K, you see that it's significantly lower. So if you're lower income or a lower income earner, it's essentially less easy. They have less easy access to these services compared to, say, 80K plus income earners, those who are college educated, and parents. And then here we asked about whether or not they're currently seeking treatment for mental health issues. And you see about 40% saying they either currently or used to seek treatment for mental health issues, and about half saying they haven't. And then here's the demo breakdown where you see this under 45 is statistically more likely to be seeking treatment currently, as well as, it's not surprising, higher income earners and parents. And then we asked here about worrying about your children's mental well-being. So this question was asked among those who have children living in their home. And you can see roughly half of parents either worry a lot or a little bit about their children's mental well-being. So parents are very split on this issue, but still 50% is a big number for those who are worrying at least somewhat. And then this just cuts across demographics. I think the lack of statistical significance here is also telling that it doesn't matter what demo you're looking at, there's a very similar level of worry. And then here we asked about children's mental health compared to 2 years ago. And again, it's relatively split, where you see about a quarter saying, yes, it is absolutely worse off. And then a little bit more than a quarter saying it's somewhat worse off. So slightly more than half thinking it's worse than it was 2 years ago. And then only 10% saying it's better. And then here, nothing really stands out in terms of it's absolutely worse off in the demos. But if you look at I think it's better, you see Blacks and under 45, higher income earners. The percentages are still low. So keep that in mind, right? It's not, it's statistically higher than the other sub demos, but it's not a high number. So it's not like those who are under 45, you know, the majority think it's better. It's still only 15%. And then we wanted to ask this question as it relates to policy, since many of us are engaged in advocacy work around these issues. And I think this slide is just very helpful for those who are addressing this issue from an advocacy lens, where you see the majority, 4 out of 5, saying that children's mental health should be a priority, either among other priority issues, or it should be the top priority. And so, and then you see only 8% saying it should not be a priority, 10% saying they're not sure. So the vast majority saying yes, it should be up there. And then when you look at the demo breakdown for that, when you look at the first column, yes, it should be the top priority. You see that similar trend track, especially in this survey, where you see Blacks, younger adults, higher income earners, college educated parents, all significantly higher in that it should be the top priority. All right, and then we ask, what are the factors that contribute to one's mental well-being? And we asked participants to rank order. So these are the factors that were ranked number 1 in the survey, and having a house to live in was ranked number 1 from about a quarter of participants, slightly less. Which is so telling, right? Like many of us work on housing security issues or financial security issues, which was 18% ranked it as number 1. And it just speaks to the connections, right, across social determinants and how to address mental well-being from a very holistic perspective. And then here are the demographic breakdowns. Again, they completely cut across demographics. All right, and then the very last slide, if anybody's interested, these are the demographic breakdowns in terms of the categories. So if you're interested in exploring like just females or just low income earners, please do let us know, because we're happy to share that specific data. So now I'm going to turn it over to Elainey, and I'm going to stop my screen share for 1 second so I can introduce her. And like I said, if you have any questions, please do put them in the chat, and we'll try to address them as we go, and in particular at the end. So without further ado, Elainey Almadrez is the Director of Advocacy and Communications at the Children's Hospital Association. She works to advance media relations and grassroots advocacy for the association. She has a background working for public affairs and social change agencies, which have included a number of healthcare clients from Johnson & Johnson to the NFL doctors. She received her BA from Howard University and a master's from Georgetown University. So welcome so much, Elainey. And I am gonna share my screen again and then give you the floor. So 1 second.
Thanks, Alex.
Sure. All right. Okay, go ahead.
Great. Well, I see a few of my colleagues have jumped on. Stacy, Elise, Jillian, hello. Thank you for joining. And first, I want to say, thank you to the Root Cause Coalition for inviting me and the Children's Hospital Association to speak on this important topic today that impacts, so many parents and caregivers, but especially something that impacts kids the most. Next slide, please. So today I'm going to be talking about our initiative, which is Sound the Alarm for Kids. So what is Sound the Alarm for Kids? It's an advocacy initiative comprised of child health groups and children's hospitals dedicated to help raise awareness on the mental health crisis amongst teens and kids. And the initiative first launched last October when CHA, along with the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry, declared a national emergency for children's mental health. And so from then on, the initiative continues to be multifaceted and focuses on urging Congress to enact legislation and increase funding to address this current situation. At the moment, we have 56 external partners and 76 CHA member children's hospitals. And members receive weekly call to action emails to help continue to raise awareness on the crisis. And I'll talk a little bit more about the other resources available to members as well. Next slide. Awesome. So what do we know about kids' mental health? We know that the mental health crisis in kids is not something that just happened overnight. Before the pandemic, 1 in 5 children, anyone under the age of 18, experienced a mental health condition on an annual basis. And it's only gotten worse since the pandemic started. According to the report that just came out this morning, we know that mental health has impacted most Americans, and they're feeling hopeful. But it looks a little different for kids and mental health disparities, especially amongst minority groups. It's left a lot of minority youth, particularly, very vulnerable. And so on our website, we've included some of these facts, and I'll read them out. Latino youth are more than likely than their peers to have mental health issues, and more than 1 in 4 Latino high school students have considered suicide. Black children under the age of 13 are twice as likely to die by suicide compared to their white peers. And the rate of death by suicide amongst Black youth has increased faster than any other racial ethnic group. And then a new study estimates that more than 175,000 children in the US have lost a parent or caregiver or a grandparent caregiver to COVID-19. And the majority of those children come from racial and ethnic minority groups. And so it's our job to continue to raise this awareness. And so here are just some of the headlines since the launch of the initiative. We've garnered media attention from the New York Times to ABC News, NPR, and others. And we continue to spread the message on social media through our advertising as well. And I'll talk more about that in the next slide. Okay, so a lot of our hospital partners and external partners have amplified the message through various social media channels and through our advocacy center, as well as through traditionally earned media. On our advocacy center, which is located at the bottom of the homepage of soundthealarmforkids.org, it has over 1,300 letters sent to members of Congress. And as more and more members join, we see a lot of activation, people messaging their members, asking them to act on this issue. Next slide. And so to help raise further awareness, Sound the Alarm ran digital video and banner ads on WashingtonPost.com and Politico.com. It targeted the White House, congressional, and healthcare opinion leaders in DC. It's garnered more than 680,000 impressions. And we also ran a radio ad with WTOP in DC, which garnered 813,000 impressions. And so here's one of the videos that we put out on WashingtonPost.com and Politico.com. We could just play it real quick.
Families are suffering. Children are harming themselves. Our systems are overwhelmed when our kids need us most. America's youth are in a mental health crisis, and the pediatric community is sounding the alarm for kids. We're urging Congress to help us address the emergency by funding crisis preventative wraparound services and treatment to stem this escalating crisis. Learn more at www.soundthealarmforkids.org, paid for by Children's Hospital Association. Families.
Thanks, Alex.
Okay, there we go.
All right. So this is where you all come in, and it's not too late to get involved. First, if you haven't already, please follow us on social. We have our Sound the Alarm for Kids Twitter handle, as well as our CHA handle up there. That includes a lot of messaging about our initiative. We actually recently launched a Spanish language website and advocacy content to provide accessible mental health information for the Hispanic and Latino communities around the country. And the way it works is, users with the browser set to Spanish, it will automatically be directed in the Spanish language website. But if you're not, then there's an option to click on a drop-down menu and click on Espanol to translate the site. Next, we have a lot of great tools available for download. We have an advocacy toolkit that provides specific resources when it comes to engaging with policymakers regarding spreading the word about Sound the Alarm. The toolkit also includes photo tiles with key stats. Some of the ones I had mentioned earlier on are included in there. We also have a resource section where visitors on the website could download fact sheets, as well as the Surgeon General's recent advisory on protecting youth mental health. And that was released in December. There are social media posts available for Twitter and Facebook that are customizable for folks, and people can insert, logos or customize them with their own content to make them a little bit more personal. And advocates can also amplify the video ads that you just saw for downloading and then sharing onto social media as well. So lots of great tools here for everyone to use. And yeah, I just want to pause there and say thank you for your time, and I'll open it up for questions or pass it back to Alex.
Thanks, Elainey. I'll stop the share so we can see everybody and open it up for discussion. Great, thank you so much. That initiative is really, really interesting, and I have a question about whether or not do you guys work directly with schools as well, and kind of share resources through that channel as well?
We have not, but some of our members, the external partners that I talked about, and some of the children's hospitals do work with schools.
Got it.
Yeah, but it's great timing right now. We're curating some of the resources that are available for visitors of the website. And so we're putting that together in this month.
Got it. Thank you so much.
Welcome.
If anybody has a question, oh yeah, go ahead, Barb.
Yeah, I was just going to jump in. Thank you both, Elainey. Really great program, Sound the Alarm, and we're glad to be partnering with that with you. And Alex, the data is always really fascinating. I found it really fascinating too, like you called out on the one slide, how the SDOH issues that we're focused on primarily through root cause really are affected by mental health. I mean, it just goes to the core of what we all know, that one issue leads to another. They're not disconnected. They are all, intertwined with the other. I'll just underscore, however, we can continue to promote Sound the Alarm and, additional information that you develop. We just can't overstate the issue and how this needs to be addressed. And I think, we've noted a couple different surveys that have come out recently. And like you noted also, Alex, our survey was done right at the beginning of Omicron, but there's still a lot of fear out there, even with waning numbers. And, the issue is real for kids, and they often get caught in the middle of these issues. So I think we're seeing that play out on the data, as well as what you and all the children's hospitals around the country are witnessing, and the pediatricians and all the care providers. So it's an issue that I just want to share as a commitment from Root Cause that we'll continue to lift up. So if anyone on the call has additional ideas, or individual hospitals, how they might want to be engaged, we're really open to that as well.
Thank you.
I'll just add too, from an advocacy lens, it would be wonderful to just generally going forward, hear from all of you and what you're working on as it relates to mental health issues and the other issues that surround it, like housing security, food security, et cetera, because I think the more and more that it becomes like critical for us to be addressing this from an advocacy perspective. It would be great to bring us together to collaborate even more so on those issues. And to the extent that the data is helpful, all of our research is available free on our website. So download it, use it. If you need the data itself and not just the slides, let us know. But it's meant to be used. So please do push it out through your channels, use it from an advocacy lens, share it with policymakers, et cetera. And then I'll just add briefly, we are continuing to work with TRCC partners and members on various research topics over the next year. So if you have a particular topic in mind that would be helpful for you all from an education or advocacy lens, please do let us know, because it often falls under the scope of what Root Cause does, since we all work collectively on these issues. So we'd be happy to have a follow-up conversation on that as well. So any questions from the group or comments?
I'd love to hear if people found any of the results surprising, you know, half of parents worried, half not, you know, just any of the initial thoughts and impressions on that data.
Yeah, Barb, access to services was higher,
Mm-hmm.
or perceived access to services was higher than maybe I would have thought, as well as familiarity with services. But when you look at, like, it's a big chunk that says they're familiar, but I think I said also, it's still a pretty high percentage, right, that say that they're unfamiliar or don't have access. So even though it's not the majority, it's still a concerning minority, I would say.
Right. Well, it's certainly an issue that, you know, I think this has been a really good overview. But like I said, we can't, even as numbers in the pandemic wane, we cannot let the issues that have been, you know, exposed and had a bright light shown upon wane with them. These were existent before, and they've been even exacerbated that much more so in the last 2 years. And however we can continue to work with CHA, we're really grateful for your partnership and all your members across the country. So
yeah, and thank you everybody for joining today. We appreciate you listening in, and definitely follow up should you have any questions or comments. Okay, and thanks, Barb.
thank you.
Okay, take